On your way, no one he know. On your way, no one he know. No one he know, no way. No one he know, no way. On your way, no one he know. On your way, no one he know. No one he know, no way. No one he know, no way.
Hello, my name is Michelle Sanborn. Until about 12 days ago, I got remarried, so I'm now Michelle Beatty for those that are not familiar with that new last name. I am CELDF's Communication Director, and I am here from the unceded Abenaki territory known within the state of New Hampshire. I'm here to introduce our next speaker, who's going to talk about Western medicine and the Great Lakes community regarding the corporate assault on medicine and public health in the United States. It is my pleasure to introduce Kirk Scirto, MD. Kirk is a family physician and a public health specialist from Buffalo, New York, and he's here to share with us about this topic. Throughout a career in global health, he has fought for environmental justice in El Salvador, Puerto Rico, and New York. Please give him a warm welcome.
Hi, it's an honor to be here today. I firmly believe that health and healthcare are human rights and that profit-making should be entirely removed from the medical care system. However, companies have been allowed to enter the US healthcare realm and eventually to run it in nearly every way as they amass astronomical profits at the expense of our healthcare. I'll explore this tragedy and go on to describe how they're devastating our public health as well. The US is the only Western nation that fails to guarantee universal health insurance and therefore healthcare access to a large segment of its people. Shamefully, 1 in 5 Americans are uninsured or underinsured, lacking Medicare for all. Americans are at the mercy of various for-profit insurance companies as they decide which life-saving care will or will not be covered. Yet in a just society, the massive profits of insurance companies and their expansive administrative budgets would instead be spent on needed healthcare. Sadly, some of my patients that I suspected of having cancer died unnecessarily, given that their insurance companies refused to cover the tests needed for timely diagnosis and treatment. And what about Americans without health insurance? Nearly 45,000 die unnecessarily each year precisely because they lack healthcare access. Compared with 10 other high-income nations, Americans have the least access to healthcare, the worst health equity, the most disastrous healthcare outcomes, even though the US spends far more on healthcare. This is not surprising, since our system funnels money away from healthcare and into the appreciative laps of corporate leaders. There's a wealth of evidence that for-profit health facilities and services provide lower quality care and contribute to higher death rates. Their greedy and speedy care results in medical system errors, which cause tens of thousands of needless deaths every year in the US. Meanwhile, pharmaceutical, lab, and other companies dramatically elevate the cost of their products and services, restricting needy patients from accessing them. While the US government has negotiated affordable drug prices with the Veterans Affairs system, it largely ignored the rest of the health system as a result of Big Pharma's successful lobbying army. Although Big Pharma produces meds and vaccines which can save lives, they provide these resources in manipulative and parasitic ways, even elevating prices up to 3,000% once they have a monopoly on a popular medicine. Nearly 1/4 of Americans cannot afford the completely illegitimate price of their meds. And for this and other profiteering reasons, 500,000 Americans go bankrupt due to medical bills every year. Pharmaceutical companies work to pressure and entice medical providers to prescribe more dangerous meds, a notorious example being their evil and successful campaign to addict hundreds of thousands of Americans to opioids. Pharma's TV commercials stir up demand for many unnecessary and harmful meds, and their production, along with medical supplies, is largely responsible for the healthcare system burning 8% of all greenhouse gases in the US. Med supply companies typically make single-use plastic-based products which elevate landfills everywhere. If there's dent in a box of unused gloves, it is hospital policy to throw it away unnecessarily. Although surgery would be quite dangerous without gloves, gowns, and masks, our wasteful policies contribute substantially to plastic and air pollution through the manufacturing process. Mercury-containing devices and some of our disinfectants and sterilization products are hazardous to our health, while medical waste incineration releases carcinogenic dioxin. Rather than pushing to decorporatize our failing health system, medical providers quite often focus their advocacy on increasing their own pay, while joining more lucrative specialties rather than the perpetual shortage areas of mental health and primary care. This is in keeping with our health care system being organized primarily around disease treatment rather than prevention. Only 3% of US health system funds go toward public health, and this insanity often goes unnoticed until a pandemic like COVID-19 causes a mind-blowing number of unnecessary deaths. Turning now to public health, I'll point out the abundant evidence that our health is not primarily determined by medical care, but rather by the social determinants of health. These are the conditions in which we are born, live, and work, and the deeper forces and systems which shape our lives, including access to food, education, employment, and housing. Beyond the realm of healthcare, massive US companies have steadily sucked the blood of each of these social determinants of health, as they've infiltrated nearly every aspect of our lives like an infestation of leeches. By advertising just about everywhere we look and listen, multinationals have successfully convinced most of us that we need ever more things that they make for us. Despite this constant deception, Quechua indigenous public health leader Vivian Camacho Hinojosa reminds us that we really only need love and a few key things that Mother Earth and her various life forms provide for us: food, water, air, and shelter. All social determinants of health. Sure, there are food companies and those providing water, oxygen, and housing construction, yet they are merely hollow echoes of our needs. Food, water, air, and shelter emerge out of Mother Earth, even if they unfortunately and needlessly may pass through a factory before they reach us. Having everything that we need striking at Mother Earth is self-injury, as her health is our health. Let's start with food. Producing food through industrial agriculture is 10 times less energy and water efficient and far more environmentally and economically costly, yet its products are sold cheaply given huge and unjust subsidies. Such large-scale fossil fuel-based agriculture not only hurts the health of Mother Earth, but also our own. As they take over small-scale sustainable farms, these companies harm our health by pumping chemicals into the land and water, including pesticides and chemical fertilizers, as they reduce the resilient diversity of Mother Earth into monoculture crops, which more likely fail, especially as we steadily warm Mother Earth. Companies commonly have make highly processed edible materials that they call food, but they commonly have few, if any, nutrients and leave us with obesity, diabetes, high blood pressure, and heart disease. Foods were far healthier and more reliable before companies reared their profit-hungry heads. How about water? Throughout the US, industries contaminated our drinking water with lead, arsenic, chromium, mercury, cyanide, chloroform, Agent Orange, ammonia, nitrates, coal ash, and many other unregulated but dangerous chemicals. Health risks of drinking this contaminated water include cancer, brain damage, and kidney and nervous system disease. Meanwhile, companies have even greedily taken over water sources of the community, privatized them, and raised water prices to unaffordable levels. Our water was much cleaner, healthier, and more plentiful before companies unnecessarily entered the picture. How about clean air? Over 100,000 Americans die each year from air pollution, which is largely from burning fossil fuels and industrial agriculture. Companies belch toxins into the air, and they make our gas-guzzling vehicles, both of which worsen asthma, emphysema, respiratory infections, heart disease, and cancer. What was our air like before it took on the bad breath of US industrialization? Well, it was clean and healthy. And what about shelter? Companies construct massive, glamorous houses and other buildings which release 43% of US greenhouse gases, largely through their heating, cooling, and other use of electricity. Pristine forests and other ecosystems that we rely on are leveled to build our increasingly sprawling cities. But why define shelter simply as being our houses and cities? Mother Earth is our shelter in a much more meaningful sense. And if we continue to alter her climate until she can no longer support human life, then we lose our only shelter. Climate change harms our health in various ways, including heat-related mortality, injury and loss of life from weather extremes, malnutrition from drought and crop failure, expansion of mosquito-carried diseases, and increasing migration and societal conflict. U.S. companies further pollute Mother Earth as they mass-produce many products which fundamentally harm our health, including soft drinks, guns, bombs, and addictive substances. Sadly, 4 industries alone account for 58% of all deaths in the world. Ultra-processed foods, fossil fuels, tobacco, and alcohol. Meanwhile, corporations mass-produce tech which lessens our need to exercise as our obesity epidemic spirals out of control. Unregulated capitalism fuels the ever-widening gap between the rich and poor, while poverty stands as the 4th leading cause of death in the U.S. Gross inequality in health outcomes result, especially for those living in poverty and for people of color. Reflecting the frightening depth of corporate influence over U.S. politics, our political and economic systems mainly provide corporate welfare rather than welfare for those impoverished by multinationals. Do companies have a right to amass as much wealth and power as possible, regardless of how it harms our health? Do they have rights to all the land, water, and air of Mother Earth? Do they have the right to destroy it to the extent that we can no longer survive in our common home? Do we blindly follow unregulated capitalism to such an extreme that we sit by idly and watch it cause our own extinction? We must answer each of these questions with a resounding no, given that human rights and the rights of nature are far more important than the alleged rights of destructive, self-serving corporations. Thanks.
On your way, no one know. On your way, no one know. No one know, no way. No one know, no way. Oh,